So here's the background to my ward. Now, I started my placement there in January, and this is where I wanted to complete a practicum. And I was thinking along the lines of there's probably an infection control issue because it's a large hospital. I got onto the ward. The infection control was fantastic. The one time I got into trouble on the ward was when I didn't tell a doctor to put an apron on because he was taking blood. All the personal care, patients were satisfied with care. So I was a bit concerned that I'd come to somewhere rather good to do an improvement project. So this is the team without whom I could have definitely never completed the project. The senior charge nurse, Marie, here on this end, anyone in that colour in Scotland is a senior charge nurse. She's fantastic, and she's very keen on quality improvement and improving patient and family-centred care. So she's already done an improvement project with the elective patients, looking at improving their admission to hospital on the day of surgery. But it was talked about the fact that patients aren't entirely clear on what's going to happen to them after surgery, what's expected of them, and that perhaps staff expectations weren't quite tallying up. So we developed an aim together, and then so that I could complete my practicum, there's certain paperwork you have to complete. So I wrote a charter and a key driver diagram, and for anyone who's written one of them, they're not the most fun things to write, but I got a good amount of support from staff within NHS Tayside. So if you haven't yet completed an improvement project, that's just to give you a rough idea of the kind of process that I went through to complete my practicum. So the aim of our project was that by the end of this month, all the patients undergoing elective knee and hip replacements on Ward 16 in Ninewells will have a good understanding of their care plan and what's expected of them, to achieve, so that when they're discharged home, they'll be safe. So before I went about putting in an intervention, I surveyed staff and patients, but I think you can see quite easily there that staff were saying, yeah, patients, they know what's going on. We do keep them informed. But patients were either saying, no, not really. And I have to admit, one of the surveys I collected from a patient that said he agreed with everything, said, but I don't really know, I just do what I'm told. So I was like, I haven't really filled in the survey very honestly then. So this was useful for me in that I could show the staff the discrepancy. And so then I went about creating the checklist.